Good afternoon, everybody. Welcome. My name is Sandro Galea. I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome to today's Public Health Conversation. These public health conversations are meant as spaces where we can engage with the issues that shape health, coming together as a community to exchange ideas and learn from our guests. Some thank yous before we begin today. Thank you to our event co-hosts, our Idea Hub and Lifelong Learning Office, including School Health Institute for Education and Leadership Development, Population Health Exchange, the New England Public Health Training Center and Local Public Health Institute, and the Activist Lab. Thank you to Meredith Brown and Alicia Noel for doing so much to make today happen. And thank you to our frontline workers, the nurses, doctors, and essential personnel who are the focus of today's conversation. Your work has been key to the health and safety of our communities this pandemic year, as it always is. Our public health and school nurses, public health officers, and Board of Health members have been working daily for months, interpreting and applying new guidance from state COVID command on sports, business opening and closing, schools, churches, and every kind of community-based activity one can think of. They answer questions and investigate complaints, and they've done their utmost to offer some sense of certainty during an uncertain time. Thank you to all who continue to work tirelessly to protect the health of our communities. And thank you to the essential workers outside the health field who have done so much to keep America upright this past year. Those working in retail, in restaurants, driving buses, delivering mail. Such work is keeping the lights on in our world. Thank you for all you have done and continue to do for us all. Thank you. Today, we are going to be discussing the role of frontline workers, how we can best support essential personnel during difficult times. I am very much looking forward to learning from all our speakers as we engage with this topic. It really is a privilege to have you all with us. I am now going to turn the screen over to today's moderator, Dr. Craig Aide. Craig is Associate Dean for Practice at our School of Public Health. Craig is going to introduce the speakers and moderate today's discussion. Craig, over to you.
Thank you, Dean Galea. So to give you an overview of our panelists, we'll start first with Lori Trammell Freeman. She has been the Chief Executive Officer for the National Association of County and City Health Officials since May 2018. In the CEO role, Ms. Freeman works to ensure our country's nearly 3,000 local health departments have the capacity to deliver essential health services to their communities, advocates for local public health within the U.S. government public health system, and assures strategic alliances and partnerships with a wide variety of federal, state, local, public, and private agencies and organizations to advance the health of our nation. Next, we will turn to Vicki Holt, the Executive Director of Home Care Association of America. Ms. Holt is a dedicated and longtime advocate for home-based care industry. She expanded her influence from state level, serving as CEO of the Pennsylvania Home Care Association for 20 years, to the national level, where she joined HCAOA as Executive Director in November 2019. Then we will hear from Phoenix Matthews, the Associate Dean of Equity and Inclusion at University of Illinois, Chicago. Dr. Matthews is nationally and internationally known for their health disparity research with underserved populations. Professor and licensed psychologist, they have more than 25 years of experience in examining determinants of cancer-related health disparities with a focus on racial, ethnic minorities and other underserved populations. We will then turn to Warren Moore. In Dr. Moore's current role as the Health and Wellness Senior Director, Operations Support and Communication at Walmart, his team serves as a conduit for communication between field associates and the home office for all initiatives and provides support to operations through its health and wellness call center. Then we will hear from Elizabeth Peralta, Ms. Peralta works in the food and beverage industry where her mission is to create a sustainable and equitable food system. Peralta has served as Executive Director of the National Supermarket Association, NSA, where she served to protect the interests of over 500 supermarket owners on the East Coast. Finally, we'll hear from Karen Robitaille, the Director of School Health for the Massachusetts Department of Public Health. Ms. Robitaille is a nationally certified school nurse and member of the National Association of School Nurses, Massachusetts School Nurses Organization. Thank you all for coming and joining us today. First, Lori Trammell Freeman.
Thank you so much, Craig. And thank you all so much for allowing me to open this important discussion. And a huge thanks to BUSPH for highlighting this topic. This topic is far more important than even recognizing the relentless nature of frontline work, the risks, the long hours, the extraordinary effort. There's also a call for action in this work that is important to highlight that I'll get to when I wrap up my comments in a few minutes. As Craig mentioned, NACCHO is the only organization dedicated to serving the nearly 3,000 county and city health departments. And we provide cutting edge skills building professional resources and programs, supporting effective local public health practice and systems, and above all, seeking health equity and social justice for all of our communities across the country. For now, I'd like to start out by referencing some work done by the Brookings Institute early on in the pandemic, back in about June 2020, to identify frontline workers. Most of us rely on our own frame of reference and daily experiences to identify frontline workers, whether it's taking the bus and interacting with our bus drivers, grocery workers, healthcare providers, butchers at meat packing plants. But there are millions of more workers on the front lines, and we can't really afford to overlook workers some of us may not see, but fail to recognize that protect all all of our frontline workers have been working to protect and serve in our public health capacity during this pandemic. Brookings, using a mix of Department of Homeland Security definitions and Bureau of Labor Statistics data, found that about 50 million people qualify as frontline workers, and this represents a majority of the 90 million people employed in America's essential industries. According to Brookings, frontline workers are defined as employees with essential industries who must physically show up to their jobs, people who must still report to work in the face of unknown threats to their physical health. Yet the term is informal, and there's really no formal legal definition of a frontline worker. Another commonly used term since the pandemic began is essential industries. An essential industry theoretically refers to businesses and other establishments that must stay open during a public health emergency. But in the digital age, telecommuting allows industries to stay open while employees stay home. And there's really no clarity on how many people working in essential industries are actually frontline workers who still must report to a physical job site. So hold on to those thoughts and let me now turn to local governmental public health. Public health departments are the unsung heroes and ultimate defenders of our health. Before there's a COVID test, before there's a patient, before there's an ER visit, there is prevention. And this is public health. This is why it is important. This is why we need it. Public health is really at the front line of defense against infectious disease and many other public health challenges because they start at the point of prevention. As we face the most challenging public health test of our lifetime, local health departments are leading on the front lines of the response. Just like grocery store employees, public transportation workers, healthcare professionals working countless hours, public health professionals are essential employees whose work is critical to slowing the spread of disease and helping to reopen our communities. They do so while working extended shifts, putting themselves and their families at risk to protect the lives of others. NACCHO is really proud to honor the work of county and city health departments as they lead on the front lines of the COVID-19 response. and as they do everything possible and put their own safety at risk to protect the health of their communities. The work of health departments is often done under the radar, but COVID-19 changed that. Recognition of our county and city health departments and the public health professionals who serve in those departments across the country is really more important than ever. Our members are playing a critical role in vaccinating the entire country, testing, contact tracing, and tracking the spread of the virus, providing up-to-date health information and education to communities, collaborating with mental and behavioral health organizations to reduce anxiety and promote well-being in these uncertain times, and offering resources to help battle stigma and discrimination. These are really unprecedented times for public health, and local health departments' efforts to monitor and mitigate community transmission of COVID are making an incredible impact. While the pandemic rages on across the globe, local health department staff are leading the way to respond to the virus in counties, cities, and towns that make up our nation. They have done so for months with no end in sight, and they do it despite incredible challenges. I am personally so grateful that they do. As the US continues responding to the pandemic, local health departments' roles have been expanding in ways that rapidly unfold as their work, expertise, and actions are needed more than ever. From administering tests to engaging in contact tracing to conducting surveillance, our local health departments are working hard to prevent the spread of COVID. Some activities include setting up mobile strike teams to provide testing to uninsured and high-risk populations, establishing vaccination and drive-through testing sites, as well as temporary health centers that allow for the isolation of suspected or confirmed cases, and developing heat maps to inform people about where confirmed cases are in the community. Despite experiencing their own fears, anxieties, and emotional fatigue, public health professionals at local health departments are supporting mental health wellness in their community in a variety of ways. They're setting up hotlines, coordinating with local media to distribute mental health resources and self-care tips, and hosting virtual town halls for community members. Local health departments have been engaged in efforts to ensure that health communication and outreach meets the needs of all the people within their communities, particularly hard to reach and vulnerable populations. Some activities include translating COVID-19 information and hosting live conference calls in multiple languages to ensure diverse language communities stay updated. Beyond their active roles in a COVID response, local health department workers continue to provide other essential services to their community, including distributing food and essential supplies to vulnerable families through the special supplemental nutrition program for women, infants, and children, providing sexually transmitted disease testing and treatment, offering syringe service programs to slow the spread of infectious disease related to drug use, and addressing the myriad of mental health and related outcomes the pandemic is contributing to, like overdoses. In order to complete these essential and life-saving activities, local health departments need to maintain a robust workforce. And our local health departments want to return to the normal jobs of protecting their communities. Many of them have been deployed for pandemic response for a long time, and they're anxious to get back to their normal work and responsibilities. As we design policies to support essential workers, local health department staff should be front of mind and eligible for assistance, including access to hazard pay and other benefits. Public health professionals at local health departments in cities and counties across the nation are equally at risk as other workers on the front line. Unfortunately, local health departments and governmental public health have been underfunded for years. The local and state public health workforce across the country has been cut by nearly 25% since 2008. Projections suggest that nearly half of local and state health department workforce may leave in coming years. In this pandemic alone, we have lost nearly 200 local health officials, the leadership of local health departments during the pandemic, due to intimidation and threats, resignations, firings, and early retirements. The job is untenable to a lot of tenured local health officials who have been doing this work for a long time. We need, the lack of the workforce means that we have to do more work with fewer people, leading to extended shifts and increased potential exposure to the virus. When the pandemic first started, for example, in Toledo, Ohio, and Lucas County Health Department, the health department had to be closed down and an outbreak response halted temporarily because so many employees had come down with COVID, likely contracted in the course of the daily work to serve the public.
Winston and Meg.
As I finish up here, back to the Brookings work I mentioned earlier, there's no federal standards per se on the competing definitions of frontline workers in essential industries. Federal law does not designate a specific agency to decide which industries qualify as essential during a pandemic, or the workers in those industries that are unable to work remotely. A lack of clear definition limits our ability of Congress and the states to protect these workers and may lead to widespread confusion and inconsistent protections across the country. We need to advocate in order to address this gap immediately, not only to protect workers during this pandemic, but to prepare for future pandemics and emergency. COVID-19 disproportionately affects certain segments of the population by education, gender, race, and other demographics. The frontline workforce includes many of these groups. I stand with all of the frontline workers represented by every speaker on this call, as well as everyone that is not represented, but who has risked their life to protect the rest of us. And we need to continue to advocate for frontline workers in the future so they are afforded protections for the work they do, including hazard pay, insurance coverage, paid sick leave, adequate PPE, and workplace protections, to name a few. Thanks so much for your time today.
Thank you, Lori. Ms. Vicki Holt, you're up.
Thank you. It is a pleasure to join everyone today and to be part of this very distinguished panel. For my allotment of time, I want to really focus on three things. I, number one, want to introduce you to the home care industry and be very specific about who I'm speaking of. I want to talk about what happened last March and what's happening today in this industry. And then last but not least, I want to talk about, because of the pandemic, now what? So with that, let's go to the next slide, Meredith. Our association represents close to 4,000 home care agencies across the country. You may be familiar with hospices and home health, and I want to be very specific. When I think about bringing care into people's homes, I think there's three different kinds of care. There is end-of-life care, which many people are familiar with as far as hospice care. There's medical care, which is usually paid for by Medicare. And then there's what I'm going to speak to today, and that is agencies that bring personal care into people's homes. This is the group that we represent. There's 4,000 of our members. And I want to talk about this industry and the important role this industry played right from the beginning of the pandemic. As you can see on that slide, today in the United States, there's about 3.1 million direct care workers working in the field of long-term services and supports. That would include home care, assisted living, nursing homes. When I pull out home care, our workers that are the frontline workers for us, we have about 1.9 million home care aides providing personal care in people's homes today. And now let me take you one step further, and I'd like to introduce you to a home care aide. Here's a home care aide. Typically, people of color serve in this role. They are low income, unfortunately, but this is what's really important for you to realize. Yet, this is the third and fourth fastest growing profession in our country. And that has been that way probably for about a decade. We also project that this particular profession is going to grow unbelievably in the next year with over 7.8 million jobs needed between now and 2026. 87% of our frontline workers, our home care aides, are female. Their age is 46, but 30% of them are over the age of 55. And 28% of our home care aides were born in other countries. Next slide. So can you believe we've been in this situation now for over a year? I'm sure all of my fellow panelists have that moment of like, oh my gosh, this is not normal, that moment. And so I call it the pandemic pivot. This is when everything got upended. Our whole healthcare system was upended. It also forced us, and is doing this today, it's reshaping how Americans face retirement. And I'll get back to that in a minute. But it also said to me, as I looked at these 1.9 million home care aides doing personal care, all of a sudden, these folks who were doing assistance with daily routines had to all of a sudden become very educated on infectious disease control. They had to learn how to use PPE appropriately. We went into high gear immediately to provide this type of services for this group of very, very important people who were keeping seniors, the ones that were most vulnerable to COVID-19, at home, which is what our government and our public health officials were telling us all to do. I sometimes look back on this time and I think, you know what? Home care was almost like the prescription for COVID, right? To fight it. We were serving seniors most vulnerable. We were helping them remain at home safe, and we were watching and monitoring their condition. So it was really important that we not only made sure our aides knew all the early warning signs, that they understood how important it was to do infectious control in a person's private home, which is always a little difficult. So we went into high gear, but we saw immediately that this pivot was all of a sudden these personal care aides. And I agree with Lori, who spoke before me. Frontline workers, especially in our field, keeping older people at home where they most want to be as they age, really are lifelines. And during the pandemic, it was so much more important that they understood their critical role that they played. So when we started educating them about infectious, educating them about COVID, we also developed campaigns. It was called The Power to Protect and Prevent. One of the things that I'm sure my fellow panelists will talk about was the need for us to make sure that our frontline workers knew that we had their back, that we were going to do whatever we could to make certain that they were safe, to make certain that the people that we were caring for in my position, that we were watching what they were doing. So we did a lot of communication that was so important. And also during this time, we saw a lot of things starting to happen. We started seeing that with nursing homes, unfortunately, with more than a third of COVID deaths relating back to nursing homes, we started seeing a switch, a subtle change that when it came to this country's reliance on nursing homes, and this was something that was very interesting, probably during July and August, Seema Verma, who was the CMS administrator, came out publicly and said, if there's one thing that happened as a result of this pandemic, it was that it shown the over-reliance of this country on nursing homes. And while they will absolutely always have a place in the healthcare system, we still need to make sure that everyone has access to having care being brought into their home. Next slide. So our challenges last year were pretty much that education. And I'm sure everyone on the panel felt that. It was so important that our workers understood what we were doing. We also established care protocols. Please keep in mind that this form of home care is pretty much, ADLs. And now all of a sudden, though, we were positioned to be not only just personal care, but we also had to become familiar with protocols if there was exposure. So we immediately developed care protocols for when a home care agency had a client who was exposed to COVID. We also did the Protect and Prevent campaign. We also were losing a lot of our aides because they had childcare issues. Everyone knows school started closing. So many of our home care aides had to make that decision to stop doing their care and stay home with their children. And of course, we also faced the decrease in a workforce because there was that fear of contracting the disease. And then we did a whole lot of emphasis on we've got your back. In home care, as I mentioned, we go into people's homes and we have systems that when an aide comes into the home, they dial in and there's a time that we know that they've gone into that home. And then when they leave, they clock back out. Well, before they went in, we established protocols to make sure that they were okay before entering that client's home. And we had a standard screening questionnaire on top of that technology that asks things like, how are you feeling? Do you have a fever? Have you been exposed? All those kinds of questions that I know you and I are probably experiencing when we go into doctors' offices today. So that was our 2020. As we moved into our new year this year, we are now still faced with recruitment and retention problems. We are indeed seeing an increase in the people who are considering keeping their loved ones at home, trying to make that work with a nursing home perhaps being a last option. So our workforce challenge, which has continued to be a problem for decades, is even exacerbated now more than ever. When the economic downturn happened in the past, that usually meant that our recruitment was better. This time that's not happening. In fact, many reporters have called and said, well, Vicki, you're probably getting a lot of new people wanting to become home care aides, waitresses, that's not the case this time. I think there's a lot of fear involved, so we are really focusing on that. We have problems with wages. I am the first to admit that we have to do a better job in sustaining our home care aides and recognizing them for the value that they bring. And then, of course, we focused on training and respect. But now, right now, folks, we have vaccination frustration. Unfortunately, we were included in that phase 1A of the vaccine distribution. We were indeed included in the healthcare worker definition. However, I'm sure our panelists would agree with me that it really depends on what state you're in and what county you're in. So we still have a very high percentage of home care aides that have yet to be vaccinated. And then we also have a high percentage of our home care workers refusing to get the vaccine. But during our last survey, we found that while there was a high degree of refusals, the other thing that was very apparent was 40% said, well, I'm not saying I don't want it, but I need more information. So we went into the mode of doing a lot of educational campaigns to talk about the benefits, to talk about the myths that are out there. And that seems to be helping, and our vaccination rate seems to be going up right now. We are also seeing that our clients, our elderly clients, are asking that they only receive a home care aide who has been vaccinated. So that's another challenge that we're facing. We have increased costs with PPE. And then, of course, because of this switch with the pandemic, because we have seen that our home care aides can really do a little bit more than we thought they could, that we're really looking to expand the scope of services that can be provided by home care aides, which of course goes back to state regulations. And then we also are seeing a renewed spotlight on bringing care home. Many people are now saying, whatever we need to do, we need to keep these congregate settings to smaller groups, because this pandemic has shown a spotlight on how we care for our elderly. And I think that's an important concept. Well, and I want to stress it again, I believe that nursing homes have a place. I just think we need to take a look at how we care for our elderly and make sure that people have options to receive the care that they want, where they want it, and how they want it. So in the future, here's what we're looking at. I think we're going to be responding to an increased attention on home care. The federal government, CMS, is looking at hospital at home programs. They're looking at things that we can do at home that 10 years ago we would never have thought we could do at home. And I think this is part of our consumer movement in healthcare, consumers being empowered to be informed and make their own choices. I think we also have to address our workforce shortage, which I think everyone is going to be experiencing, and really do a better job in making sure our workers are safe, they have the tools that they need, the education that they need, and that they are compensated fairly. And we also, I think, have to start doing a better job in our arena of developing standard sets of metrics that we can show the data that proves that when a person is at home being monitored, that they can do well and that we can decrease the expensive costs of hospitalizations and other acute care settings. So with that, I want to thank you for this opportunity, and I look forward to having a real healthy discussion with my fellow panelists later. Thank you.
Thank you very much, Vicki. Now we'll go to Dr. Phoenix Matthews. Dr. Matthews, you're up.
Thank you. It's wonderful to be a part of this important discussion. I'll be sharing with you some information related to nurses as an important constituent of frontline workers. You know, it was in my bio, it was described that I'm a clinical psychologist, which is the case. But for the last 18 years, my academic home has been in a college of nursing. And so over this past year, I've been very intimately involved in the efforts of our nurses, both from our faculty and student perspective, as well as the nursing experiences of the hospital that we're associated with. So I wanted to share with you a subgroup within the overall nursing workforce, and that's specifically talking about issues among Black nurses. See, each of us are well aware that right now we're in the middle of a national health crisis. Data from just last night says that we're up to nearly 524,000 Americans who have lost their lives to this terrible disease. In this past year, as a panelist before me has talked about, is that we've had a number of important work groups that have been on the front lines, and it certainly has been the case for nurses. Nurses have been on the front lines in terms of the testing efforts, and now more recently in the vaccination efforts. But as Janice Phillips, who was an alumni of the University of Illinois at Chicago, has talked about, is that there isn't a health issue that comes before us as a country that nurses aren't serving as important frontline workers. What has happened with this recent pandemic is that it has underscored the urgency of the nursing shortage in this country. In the next 10 years, it is anticipated that we will be in deficit of nearly 1 million nurses to meet the healthcare needs of our population. As a result of that, we've seen the additional impacts of the pandemic in terms of the increased intensity and the long hours and the difficult working situations that our current nurses have been experiencing. Specifically, there's been an dramatic increase in the average number of hours that the clinic nurse works. And this has been associated with, in research study, increased levels of stress. So this shortage that we've been experiencing historically has become even more problematic as we're in the midst of this pandemic. So across the board, across the board, nurses have been negatively impacted by the pandemic. In a recent study that was conducted, significant mental health concerns were noted. 50% of the respondents nurses in this survey reported symptoms of depression and anxiety, and 33% reported symptoms of post-traumatic stress disorder. What were the contributing factors to the mental health concerns? Concerns about their personal health risks, being on the front lines, exposure to excessive numbers of death, individuals dying and that they've been trained to care for or have experienced historically. Compassion fatigue, struggles with having access to personal protective equipment, especially in hospitals that are in rural and other underserved areas. Stress and exhaustion, and then the overall political climate associated with the dealing with the pandemic, as well as the rollout as the vaccination efforts. But my work as a psychologist is looking at health inequalities. Where are the groups that are having the most difficult experiences? And it's come to the fore that nurses of color, and in particular African-American nurses, are confronted with additional costs during the pandemic. So what are some of the unique risk factors facing Black nurses? Well, we know from the data from very early on in the pandemic that the pandemic has discriminated. We see that communities of color have nearly twice the rates of COVID-related deaths compared to white and Asian groups. We know that Black nurses are more likely to both work and to live in communities that are very highly impacted by COVID infections as well as death. And so again, the living in, working in areas in which there's such a high concentration of illness is playing an additional role in the stress associated with Black nurses. They're also experiencing secondary trauma associated with caring for the most vulnerable. And this care environment, especially in the ICU, is different from anything that we've seen since the AIDS epidemic, when the knowledge about the infection and the contagion of the disease resulted in our patients being extremely isolated, and their care providers being their primary sources of not only healthcare support, but physical and emotional support as well. One ICU nurse describes it in this way: I can possibly be one of the last people that these patients see. And I think that is something that kind of hit me very hard. So these, especially with nurses who are, again, in these high impact communities, these are additional stressors. On top of that, the data suggests that nurses of color are more likely to both contract and die from COVID-19 compared to their white counterparts. So 18% of US nurses who have died have been African Americans, while they make up only 12% of the nursing population. So, okay, disproportionate impact of the illness. And you can see that that is true for other women of nurses of color as well. When we talk about vaccinations, we're also, as a community, disproportionately impacted. There are concerns due to the historical mistrust and abuses associated with the healthcare environment, and research that many Black Americans have distrust about the vaccine and higher rates of hesitancy. So there is a need for concerted outreach, education among community members at large, and including our nurses of color who are vaccinating at lower rates as well. There are also issues in the minority communities as it relates to access to the vaccine, even among those individuals who are open to receiving the vaccination. So this, again, brings additional stress onto nurses in terms of navigating these spaces around vaccination, as well as how to outreach and to educate members of their own families and communities as well. What we're also seeing is that the pandemic is exacerbating existing community disparities. We see that recent data suggests that the pandemic has created both food insecurity and housing insecurity among communities of color. And in a study that was published in this past week, there's been a surge of drug overdoses among Black Americans during this time period. So an increase in opioid use where that had not been the case and previously. Also, that we'll remember that in the middle of this past year, we saw the intersections of a long history of racial and social injustice and health. So at the time when the pandemic was in full force, we were also having a great deal of social protests associated with police brutality, and nurses who were on the front lines exposed to attitudes among coworkers about the protests, about police brutality, and race and social relations. The consequences is that many nurses have reported perceptions of lower levels of support from their coworkers in the healthcare setting. So we know that support from coworkers, mutual respect goes a long way in terms of helping individuals in the environments deal with stress. But there have been reports that due to limited diversity of the overall workforce, that there has been a reduced access to social and emotional support among nurses of color. Well, in addition, minority populations have specific barriers to reaching out and seeking mental health treatment and other forms of social support that can help to mitigate these additional stressors. Some of the barriers relate to access to care, stigma associated with accessing and utilizing mental health services, and the limited number of culturally aware and competent mental health professionals all represent significant barriers to seeking and receipt of mental health care. So as we think about the needs of these communities, nurses in general and nurses of color more particularly, we think about the levels and the different types of interventions that are needed. It is clear from the data that all nurses in frontline situations are in need of additional mental health supports and intervention. This is additionally true for those nurses who are located in high impact units such as the ICU. But what we also recognize is that regardless of their placement, their work roles, is that there are unique needs among nurses of color, and including African-American nurses during this time, that need to be taken into consideration in system-based approaches to assist these frontline workers. So what types of things do we know from a psychological standpoint that helps to reduce burnout, helps to improve coping and reduce the negative mental health concerns associated with their work? Emphasizing healthy strategies for coping, increasing access to therapy, providing resources and time for physical activity and exercise, and also creating on-site avenues for receipt of social service, supportive services, both from professionals as well as peers. And again, keeping in consideration that minority and nurses of color may need separate groups to address some of the unique needs that are confronting this population. The National Black Nurses Association has responded to the data showing the differential impact on Black nurses, and just this past December released online services that are mental health services that are available for free of charge for nurses to help relieve stress and then increase their coping. There are other organizations that are springing up to create intentional communities for Black nurses. Black Nurses Matter is a new group that has more than 2,000 members, and it was started by my doctoral student, Dr. Alicia Hart, again, to provide a space for nurses of color to exchange information, resources, and support. So thank you, and I look forward to further discussion.
Thank you, Phoenix. Next up, Dr. Warren Moore.
Hey, good afternoon. Thanks for the time today, and I look forward to the discussion. One of the things that was read in my bio, I did used to do our central operations work, but currently I'm vice president of our neighborhood market pharmacy operations for the US. And so today I'm going to talk to you a little bit about, what we're doing to help out in this pandemic to get vaccines in arms, and really what we've done since the beginning to take care of our frontline workers, including our frontline grocery workers, as well as our pharmacists and technicians in our stores. I thought that I would start out today and really talk about our history and the principles for which our company is built on, because those principles help you to help you to understand how we're showing up today for our associates and our customers. As you can see, we've been in business now for almost 60 years, and our purpose was clear then, and it is still clear today, that we save people money so they can live better. Our founder, Sam Walton, opened the doors to the first store in Rogers, Arkansas in 1962. And that idea of serving small rural communities that were overlooked by major retailers is how we were founded, to offer customers the best quality of merchandise at the lowest price. As you can see here, we actually opened our first pharmacy in 1978. So now we'll be 43 years in that business. And it was really March of 1991 when Sam Walden was going through his battle with cancer that he began to experience the cost and the markups and the lack of transparency in the healthcare system. And he really challenged us as a company to make a difference around healthcare. Since that time, as a company, you see here, we've launched $4 generics that made, pricing for everyday generics affordable. We opened Walmart health clinics. And today we operate almost 5,200 pharmacies across Walmarts and Sam's. As we've grown throughout the years, we're using our strengths to make life easier for busy families. So you see us get into things like online and .com, again, that playing dividends to how we're scheduling appointments today. We're equipping our associates for the future of work by launching our learning academies, where our frontline associates come in and they learn about how to grow and do different roles within the company in order to grow themselves. We have what we call Live Better You, where we invest for $1 a day. An associate can get a degree from universities like Purdue Global or University of Florida and more. We're driving for shared value, and we're trying to solve challenges that the world faces, like sustainability and racial equity. And, that's one of the things I do in addition to leading our pharmacy operations for neighborhood markets. I lead our health equity work for the company. Next slide. At Walmart, we have a saying that our people make a difference. And that's in fact on our name badges. And from the beginning of the pandemic, we prioritized the health and safety of our associates. We invested heavily to keep the 1.2 million of them healthy and safe during that period. And, we went back and we started out with a 2-week emergency leave policy that when people didn't feel comfortable coming to work during the initial days of COVID, and even now that we had a COVID leave policy, we sourced and procured PPE, hundreds of thousands masks we gave to associates as well as customers. We installed sneeze guards for our cashiers and our pharmacists. We laid out sanitation standards. We did one-way shopping aisles. And then as the pandemic wore on, we realized the economic toll it was taking on everyone. So we actually accelerated our quarterly cash bonuses for associates. We provided $4 telehealth visits for both medical and mental health. We closed stores early so that we could clean overnight, and we instituted senior hours. In fact, when we look at what we're giving back, we gave over $2.8 billion back to our associates during this time. You see, it's because we realized really at Walmart that it's important, the role that we play in our communities we serve, and our stores are a center for well-being for our associates and our customers. Next slide. So as we transition from the initial days and testing, we did testing over the US as well. We're now into the vaccine rollout. And currently today, we're in 40 states and jurisdictions in more than 2,300 of our locations giving vaccines. We're listed as a preferred provider in 33 of those states. So that means we're listed with the state-owned websites as a place you can go get your vaccine. As supply continues to become available, we're looking to leverage our 5,200 pharmacies, our 18,000 pharmacists, and 32,000 technicians that we employ to deliver millions of vaccines every month. We believe we can do up to 13 million a month at the peak. And our footprint really provides us with a unique level of access as a company. We see 150 million shoppers come through our stores each and every week. We have 90% of Americans live within 10 miles of a Walmart, and nearly 4,000 of our stores are in medically underserved areas as defined by HRSA. So when we go out and we select sites, we partner with the CDC and we utilize the Social Vulnerability Index along with other measures like infection rates, availability of healthcare resources, and different markets to help us pick the sites to provide the greatest access. In addition to doing that, we're doing mass vaccine clinics across the US, located within our Black and Hispanic communities. We know too that it's beyond just access, that you actually have to get vaccines in arms. It's a saying, right, that vaccines that doesn't save lives, it's vaccinations. And so vaccine hesitancy is a real challenge that we're facing. And we really try to focus our efforts around what the data has told us. One, you start with the science and the facts to dispel any of the myths out there. And that's one of the biggest ways that you can begin to overcome hesitancy. But you got to have friends and families that get the vaccines. You got to have trusted voices in this process. And so one of the things we've done as a company, we have started to leverage the science and resources from the CDC and drive those messages home. One of the things that we're fortunate to have in our leadership in our health and wellness business at Walmart is two medical doctors. One, Dr. Cheryl Pegas, who is our executive vice president, who's a cardiologist and has a master's in public health and equity space. And then Dr. Tom Van Gilder, who worked at the CDC. So we leverage their voices to help drive and encourage, and when it's everyone's time to get vaccinated. We leverage our large corporate meetings, our executive communications to the front lines, again, as ways to get the information there. So it's in regular team meetings, it's in town halls. It's like this today, we kicked off our year beginning meeting and we had information around COVID and had an interview of one of our first pharmacy associates who got the vaccine out in New Mexico. We provide direct communication to our store teams. So if you're in a state, you can actually click on your state and you can understand who's eligible and what's going on in the states. And then lastly, I'll say we partner with national organizations that have reach into all of our BIPOC communities. So our Black, Indigenous, Asian, and people of color communities. And many of these organizations that we've interviewed and vetted, we've given funding to because they reach millions of individuals in their community and they have effective, culturally sensitive strategies to affect change. Next slide. So as all of that is going on, I'll leave you with a story of our pharmacist, Godfrey. As we have all learned over the last year, our healthcare workers are true heroes, and they've been up against the challenges like everyone else. But Godfrey recently had an opportunity to vaccinate a woman who works in hospice. And this woman also had a daughter who lives with a disability. The woman shared that she wanted to take a selfie while she was getting her vaccine, and so she could show her daughter. But then this patient began to break down and cry. You see, it was at Christmas time when this patient asked her kids what they wanted. And they both told her they didn't want any gifts. They were just grateful that their mom was still alive and she didn't have COVID. Because see, this lady works in hospice and she was working on the front line. So she wasn't getting this vaccine for herself. She was getting it for her children. She had been worried because if she got sick, she didn't know who would take care of her daughter if she couldn't. So through her tears, she shared with Godfrey just how excited she was to share back with her kids that she had been vaccinated and that they no longer had to worry about their mom dying of COVID. And so it's just, as I'm here today with our panel, and as we're here today with all of you frontline workers here on the call, my hat's off to you for what you're doing. Know that we're all in this fight together. And I look forward to a further discussion on how we can turn a page and hopefully put this COVID pandemic behind us. Thanks for the time.
Thank you, Warren. Next, we have Ms. Elizabeth Peralta. Elizabeth?
Hi. Yeah, my name is Liz Peralta, and I was formerly the executive director to the National Supermarket Association. Currently, I'm working, I'm a co-founder. I recently just started my own startup with two other people who truly care about food access. And so it was all born from the NSA. So I really want to start off by saying the history of the NSA, which is the National Supermarket Association. They're actually the largest independent Hispanic-owned minority association on the East Coast, and it's a little over 500 supermarkets. But what was always surprising to me about the stories of the individuals that I represented over the last year was how they began. And to me, I think that's a really great starting point. And so the NSA started over 30 years ago because the big supermarkets like Pathmark and Acme had left the areas that were here in New York. And what ended up happening was that a bunch of bodega owners got together and said, our community can't survive with access to fresh produce and access to things that should just be there. So they pooled their money together and opened up their first supermarket. And after a year, they pulled up the earnings from that supermarket and opened up two more. And the story continued us to where we are now. One of the most interesting, and I just want to thank everyone who's been a speaker here. The data is incredible, and it's just something we should definitely focus on. But I also just want to shed light on the people. You know, oftentimes when we think about frontline workers, we think about doctors, we think about nurses, and they're so important to this journey. But oftentimes the way that we paint the picture of the grocery store owner is one that's really harsh. I don't know if a lot of you remember, but at the beginning of the pandemic, the most, at least in the New York City area, we had elected officials going to supermarkets and accusing people who were freaking out about COVID themselves about price gouging. And that was so harsh because you have store owners who, like the previous speaker, Dr. Moore, you know, just like Walmart, our supermarket owners were providing PPE. They were closing 2 hours early. They were opening several hours early because not only was it restocking shelves, but now it was super blast, cleaning everything. Every crevice of the store you could imagine, they were doing that. And the amount of precautions that our store owners were taking, it just felt almost like a backlash to see that Department of Labor would show up with, and the worst part of it was that in some cases they were showing up with news crews. And that is the harshest thing, because in a world where we live in, where the media is so influential, you know, even though later on the story was like, we made a mistake, people don't see the follow-up. They see the first story of you going into that store and you take away something. Grocery store owners pride themselves in being embedded in their community. And when you show that to their community, it's almost like you're taking away the trust that's taken over 30 years to build. So I wanted to start by saying that one thing I've appreciated is that as COVID has gone on, we've had more empathy towards grocers and what they do, especially because grocers are the ones that are opening up their parking lots to, do antibody testing. They're the ones that are, instead of throwing out their excess food, one of the things that I saw most clearly. So another story is, oftentimes my job was to call members, go to their stores, understand policies, talk to elected officials. But the consistent comment that I heard from store owners was, Liz, we're good, the store's good, there's people who are hungry, how can we serve? And so you had grocery store owners waking up even earlier and working out shipments and giving out donations and completely just rotating the way that they do business to continue to support their communities. So I wanted to just highlight that, but I also wanted to say what COVID meant to these supermarket owners was that they had to essentially reinvent the way that they do things. Like, for instance, we think about PPE as something that's a given, but a grocery store owner doesn't have to think about masks. They think about gloves. But as Dr. Moore said before, we were putting up plexiglasses. We were doing things above and beyond, which meant that they were actually coming in at more of a loss every month. Because at the end of the day, it wasn't how much money can I make today, but how can I take care of my community so they can last forever. And oftentimes, one of the most heartbreaking moments for us, and I think one of the grocery store owners called me once and they said, it feels like they keep giving us seats at the table, but they disregard what we're going through. And a great example was that is, I sat on some task force with the city, with the government. And in New York, when the protest hit the peak, there was a closure, like a curfew that was put out, and we were the last to know. And if you know the grocery store business, you know that it's not just what happens in our store. Our delivery boys are out there, our distribution trucks are out there. And so if we don't have the time and space to protect our industry, that means that that store that services all those people that come to shop will no longer be open. We had store members who didn't have enough lead time to protect the people that they serve. And what was saddest for us was knowing that the same day we had a call in the morning with government officials who chose not to share with us this information. And so, I know this is I'm honored to be speaking here at the Boston University School of Public Health, because I know that on the other side, there are an audience of people who aspire to be in this industry, whether it's in nursing, whether it's in grocery stores. And what I challenge you to think about is that advocating for us, and to be quite honest, when you look at the percentage of people who own supermarkets, they're primarily people of color, and there are not as much resources to support them. For instance, a lot of the languages of the materials that were passed out were only in English. I think it's fair and safe to say that that should not be the only language that is distributed. The other thing was, it felt like we were always on calls with elected officials, which were great, but the other thing I want to remind people, that a big part of this world is not just community, but partnerships. So one of the things that we were so excited was we worked with Lyft and Uber to create a partnership so that we could get free codes to seniors to shop at our stores at senior hours, so that they would not have to, further endanger themselves by being surrounded by people who maybe are high risk, or they could get the virus in this way. That was one partnership we were very proud of. And the other thing that we did at NSA was, again, we noticed there was a huge lack of resources, and they just so happened to be taken away from immigrants, right? Like one of the first things I heard was that if you were married to someone who was undocumented, you automatically did not get a refund check. And that means that is such a heartbreaking thing to hear, because that means that although you might be a citizen and your kids might be citizen, because you married someone who's undocumented, you now don't get that resource. And so for us and the members of the National Supermarket Association, who are all immigrants from the Dominican Republic, they felt this so hard. And so we started something called Let's Feed NYC, where we partnered with different medical groups, distributors like Coca-Cola and Porky's, to give people food. But we took it a step further, because again, when we talk about giving back, we talk about partnerships. And we know that we love food, but we're not healthcare providers. And that's one of the biggest partnerships that we were able to forge, a relationship with Fidelis Care, so that not only were people able to get free food, but they were able to check in on themselves, their mental health, how they're doing, resources to point them to different channels that could get them the things they needed. And last, I think, and the other thing was, the way that we've started to think about excess food in this time is so important. And I think it's something I want more people to think about as you continue to pursue careers in the health field, because there is a ton of good food in the system. It just always ends up in the garbage. And so if together we become thought leaders, together we can find solutions that will not only help reduce carbon emissions and better our planet, but at the same time, make us together a happy human planet that together we will grow. And yeah, that's really it. I think that one of the biggest blessings of being and leading in the last year was the ability to listen and link, right? I think it's so important. I am no one without my members. And so thank you. Thank you for giving me this opportunity today.
Thank you, Liz. And finally, Ms. Karen Robital, you're up. Karen?
Great, thank you so much. Let's see, I think I may need some help with my slides. That would be great. It always works well when you practice, but not so much when you go to actually execute. So if you can bring those up for me, that would be wonderful. Thank you. And I want to thank you all for the opportunity to present the experience and the work of Massachusetts school nurses during the COVID-19 pandemic. There's a national conversation happening right now around returning our students back to school, and I hope to illustrate how school nursing staff are integral to that effort. You will hear me use the terms we, us, and our during this presentation. That's because after 23 years of working in the field, I closely identify with my school nursing colleagues. Next slide. So the next few slides I've included just to give you some context around our student population in Massachusetts. Next slide. On this slide, please note that almost half of our students are considered high need, meaning they belong to one or more of these other categories. Additionally, according to the CDC, nearly 1 in 5 young people in the United States has a special healthcare need. And these range from anything like asthma to diabetes to conditions leading to very complex care, such as muscular dystrophy. Next slide. So school nursing is actually a subspecialty of public health nursing, and as such, school nurses are included as part of the single largest group of public health practitioners working in the US. Next slide. A little known fact about school nursing, about the school nursing workforce, is not only do they maintain licenses as registered nurses, but in Massachusetts, school nurses are also required to have a bachelor's degree at entry level and to also maintain an educator's license through the Department of Elementary and Secondary Education, which means eventually they need to pursue an advanced degree and/or a national certification process. Next slide. The Massachusetts Department of Public Health School Health Unit provides consultation and guidance to every school health professional in Massachusetts, as well as to our public health and education partners. We also provide training and grant funding to help schools and districts grow and expand their health service capacity in order to deliver comprehensive school health services. Next slide. So this is a graphic representing the multifaceted role of the school nurse. I think most people have a vision of what they think a school nurse is. But consider this story. A young man with severe cerebral palsy who is wheelchair dependent has significant attendance and behavioral issues. As part of the nursing assessment, we find that the family has limited English proficiency and is reluctant to engage with the school. A bilingual nursing case manager works with the family and asks if she and his school nurse can make a home visit. What they discover is that the home has no wheelchair ramp. Family members must lift the growing boy and carry him out of the home to his chair and to the school bus every day. Not only does this seem insurmountable some days for this family, but it also limits the family's ability to include the boy in any family outings. The nurses obtain a ramp for the home, and both the attendance and the behavioral issues vanish. Next slide. So what are some other outcomes of school nursing presence? In Massachusetts, school nurses return on average 92% of student visits back to class. And in a study conducted again in Massachusetts in 2013, a cost-benefit analysis found that for every dollar invested in school nursing services, society would gain $2.20 by preventing lost productivity on the part of school staff and parents. The job of the school nurse is to keep our students in school and ready to learn, and we are very effective. Everything we do is in support of this goal. During the pandemic, school nurses have been critical players in ensuring not only access to school, but also in creating bridges into the home so that our students stay safe and healthy. Next slide. So now I'll talk more about how school nurses pivoted to address the unique issues presented by the COVID-19 pandemic. Next slide. So schools have multi-hazard plans that include pandemic planning, but generally lack a long-term vision, which is what is found in a continuation of operations plan. We have not previously planned for long-term school closures. So this presented our first challenge. School nurses rose to meet this by devising creative ways to reach out to students and families, whether through virtual office hours or during school meal deliveries. At BU Shield and the School Health Unit, this also meant converting all of our trainings to the virtual realm, many of which are required for school nurse licensure. When we faced planning to reopen schools, school nurses were at the head of that planning table, translating health information for educators and families, and tackling issues such as triage of sick students and staff, and caring for our medically complex students. School nurses also became PPE experts, just like their hospital-based colleagues, as they navigated how to manage aerosol-generating procedures in the school setting. Next slide. And as we all now know, contact tracing and case management is critical to controlling the spread of the disease. And school nurses' relationships with students and families meant they joined their public health partners in this task, sometimes 24 hours a day, 7 days a week for the last year. Additionally, as nurses are the most trusted profession, utilizing school nurses to educate their school communities can help with vaccine acceptance. BU Shield and the School Health Unit provided some training and tools to help nurses with this task. And school nurses have also joined their public health and first responder colleagues in staffing vaccination clinics. Next slide. The effort to provide testing for COVID-19 in schools for both symptomatic and surveillance purposes has been very time-consuming, but also very important in enhancing the sense of safety for families and staff. In order to help school nurses with this task, BU Shield and the School Health Unit designed and implemented a training program for school health staff on the Binax Now rapid antigen test. Next slide, please. So, what's next for school nursing? We need to grow and continue to develop our workforce in order to meet the ever-increasing needs of our students and families. Social determinants of health and health disparities are also reflected in the children we serve. We need to break down silos between school health staff and public health and healthcare institutions. We need to look hard at workload and staffing ratios and admit that old methods of calculating may not work anymore, a fact recognized by the American Academy of Pediatrics. We need to work hard on recruitment and retention as our workforce is aging. The average age of the registered nurse in the United States is 52. And this is also reflected in the school nursing workforce. School nursing needs to be widely promoted as a possible career path, and we need to realize that retention depends on adequate preparation for the job. We can do this by providing continued support in this unique and often isolating role, as well as opportunities for educational and career advancement. Next slide. So thank you again for your time and this opportunity to share with you about an invaluable member of every school community, your school nurse. Thanks again.
Thank you, Karen. And to all of our panelists, if we were in the real space together, you would hear this thundering applause, but just imagine amplifying this right here. We have a little bit of time for some questions, reminding the audience that you're welcome to write your questions in the chat, and I'll relay them to our panelists. There is one question here. This is for you, Vicki. You in your talk spoke of expansion of services. Can you say a little bit about that?
Yeah, I think it really is, it's dependent on what state you're located in. Our home care regulations vary from state to state. In fact, there's probably about 20 states that have no regulations for home care agencies. However, since the pandemic, there are several states taking a look at nurse delegation to allow our frontline workers, our home care aides, to do more. They are very capable to do more. I think our system has such demands on it that we need to look at expanding their scope of services. So we're looking at things like medication assistance. Some states don't allow our home care aides to even touch a pill. Well, everyone knows that seniors are on a lot of medications, and many times families need help in reminding them to take their medications, handing over the pills, things like that. So medication management, there's even discussion about feeding tubes, catheter care, very skin types of care, those kinds of things, but it really varies from state to state. But you're going to see that in California and Illinois in the coming year, I'm sure.
Thank you, Vicki. And to you and the other nurses, perhaps Dr. Matthews, you could take this question in terms of the growing age of our national population and the continued low numbers of nurses across all sectors of their employment. Do you have a sense or have any comments around how we're going to meet this need as we move forward, and how we can encourage the support for those workforces?
Yes, thank you for that question. There is a lot of interest in becoming nurses, and it's actually increased during this time of the pandemic. Young people have seen these frontline workers and know the tremendous impact that they're having in the patient populations. So one of the things that we need to do is to, especially in underserved populations, to be able to reach out into the high schools, really work with those individuals there to build those pipelines and bridges into higher education. So working at the high school level, at the community level. Chicago, like many large urban settings, has a very strong community college system, and to really have four-year colleges where I'm located, similar to the ones where I'm located, reaching out and establishing those bridges to higher education. So high school, college, and then also during the course of their education into the nursing program, the four-year degree, really focusing on providing additional resources such as the urban health programs and connection to communities that they most care about in order to increase their motivation and the salience of the work that they would be doing.
There's a follow-up question. Do you know whether the numbers of enrollment across the country or locally for you for nurses and nursing schools are going up?
At our local level, no, we have not had a reduction. Our numbers are either we have 5 different campuses under our umbrella. Either they're exactly the same or there has been a slight increase. So yes, there is a lot of interest. Now, I know that in some areas and some degrees that there has been a reduction because of the financial pressures experienced, but we have not seen that at our institution.
Karen, can you speak to how we're trying to find ways to recruit and encourage nurses to consider a career in school nursing?
Absolutely. I think that many of us work with our local colleges and universities and actually go in and talk about school nursing as a possible career choice. And that's one major way that we contribute to the recruitment. Also, just being role models in the schools in which we serve students oftentimes can lead students to consider a career in nursing and even further in school nursing. And I know that as a former high school nurse, several of my former students did go on to become nurses, and there's absolutely nothing more gratifying than that. And we need to support our young people. I mean, really, this comes down to an affordable, supportive environment to grow nurses in, and we need to be providing that.
Thank you. Liz, can you say anything as you see what kind of challenges the grocery stores that you're working with, how are they doing managing keeping their workforce engaged? Are they having challenges keeping their workforce given what COVID has done in the last 10 plus months?
Yeah, I mean, I think that in the grocery store world, we saw a lot of people quit their jobs at the beginning, primarily because they were afraid. Some people felt like their status really was important, and if they got sick, they wouldn't have the resources. But I do think that over the last couple months, we've seen the return, right? More grocery store workers have come back. They feel stronger. And a lot of it has to do with the way that the government has chosen to protect with hazard pay, but it also has a lot to do with the owners, right? Like the Walmarts of the world, the NSA supermarkets of the world, we care about our people. And no matter what happens, we're constantly going to be proactive. If the government can't do it, we will. And I also noticed here, someone asked a question about what are the measures being implemented to increase the services in rural areas and decrease the probability of inequity in care for this population. One thing I want to say and shout out Walmart is that Walmart is wonderful because they actually are able to take EBT SNAP online, which allows for them to deliver groceries to places that we label as food deserts. This is something that's an uphill battle for grocers because POS systems are like a monopoly sometimes. So if anyone is there in the audience, you can call your local elected official and continue to ask for them to allow independents to be able to take online orders because that's the way that we service our community. And more often than not, because this system doesn't exist, most of the time what grocers are doing, they give free groceries to those people in those communities because they'd rather take the loss than have those people not have food or any resources.
Warren, can you say anything about your workforce and how Walmart has tried to kind of stabilize and support and mitigate any kind of losses given concerns of employees?
Yeah, I think first I would say, like I went back and talked about our policies. We tried to stay ahead of what was happening there to keep our associates safe, to allow them to raise their hand when they had concerns, to pull forward bonuses, et cetera. We, even outside of our stores, obviously we allow people to, to work from home that way. I think right now we're seeing the states open up and start to have now grocery workers be eligible for the vaccine. So we're starting to be able to vaccinate grocery store workers and even some of our own retail workers. So that's going to help during this time as well. And I would say this, as I think about, pharmacists, one of the things that this has opened up is being a pharmacist myself, I haven't seen pharmacists be talked about as much as they are today in this space. But what we're seeing in the area of pharmacy is that, and I know I'm amongst a lot of nurses here, but pharmacists is one of the trusted professions as well. So you have a lot of trust there. The experiences that people are getting when they come in, it rates high. When you look at the healthcare continuum, when you look at things like JD Power. So the experience is good when you go into a retail pharmacy. And now there's more permission to do more in the space, to lean in, to help with some of the shortages that the panelists talked about. So I think we're trying to do it from all fronts. How do we highlight our pharmacists, keep them safe, keep them propped up, give them the resources, give them what we call surge pay as well for the work that they're doing. And then for the same token, how do we take care of all associates, continue to keep our eyes set on our frontline workers, where we're seeing mask mandates go away, but we're still having our associates wear masks to keep them safe as well. So you'll see us continue to lean in. We'll continue to be pro-associate, continue to be innovative on the side of how we take care of them. And again, if we do that with 1.3 million associates here, we can make a big impact to our communities that we all come from.
Thank you. Lori, from a more systemic view, when it comes to policy, what policies would be most beneficial to frontline workers that community level advocates can help support and champion?
Well, I think I mentioned a few areas that we can really put some advocacy effort into, including making sure there are clear definitions of frontline workers and who, what essential industries comprise those workers and who those workers are within those industries, and then ensuring that they have the proper protections that accommodate the risk that they're taking, especially during pandemic, by doing those jobs. So things like the hazard pay, things like access and insurance, making sure they have coverage, paid sick leave, supports for a safe workplace. Those are all policies that can take place at any level, including local, state, and federal. But the more pressure we put on our systems to provide these protections for these workers, the more we'll be able to attract workers to these workforces and be able to keep them even during these difficult times that our country is having. But if we don't have those protections, who really wants to work in these industries if they're not protected? So we have to ensure those protections exist.
Vicki, I'll give you the final question. You spoke a little bit to the kind of gray wave and of seniors that are moving forward and the population boom that's going to come from that. Thoughts about how we bolster home care and other kinds of care for elderly as our population of seniors grow?
Thanks, Craig. Quite honestly, we just need to pay attention. We need to have a national strategy for how we're going to care for this growing elder population, a very concise and comprehensive strategy that includes lots of the panelists, the groups that they represent. I think, one of the advocacy, and I'll go back to that other question about what can we do on a grassroots as far as advocating? Well, I think we all talked about that our frontline workers are so valuable that they need to be respected and seen as a critical link, especially to our senior population. Right now, the Congress is getting ready to vote on the next COVID relief package, and in that package is a 10% increase for the federal match for Medicaid. We have got to make certain then that if that's about $12 billion that will be going to state Medicaid programs to increase their work in home and community-based services, let's make sure that those increases go to the wages of our frontline workers. It is so important that we bolster, and I think everyone here I know Phoenix talked about the shortage of nurses. We have a shortage of a lot of different healthcare professionals. We have got to start paying attention to the critical role of healthcare. We have a strategy, and that's one thing the pandemic has knocked down a lot of silos for us. I mean, look at the panel today. Never did we think that we'd be on this panel, but boy, do we all link together, just like Liz said. We've got to start coming together when it comes to what is our future for this growing elderly population. And we are not ready for it, and we need to be ready for it.
Thank you, Vicki. You have
Thanks,
that
Craig.
final word. Thank you all for coming. I send it to you, Dr. Galea.
Well, first of all, thank you, everybody. Thank you, Dean and Ray. Thank you, all of you, for outstanding remarks. I have written, and I think the data are very clear on this, that this pandemic has been experienced deeply unequally. And I want to say thank you to all of you for bearing witness to, I think, the group in our society that has borne most of the hard work during this time. I think it has been the frontline workers of all stripes, from supermarket employees to retail workers to nurses to home care aides, who really have been, since day one of this pandemic, bearing the greatest burden of the work that had to be done during this pandemic. So I want to say thank you. I want to say thank you to all of you for really giving outstanding presentations that remind us of that work. And I want to say thank you to everybody in those spaces for everything that you have done. And thank you to our audience for participating in today's conversation. Everybody, stay well. Have a good evening.